My name is Robin Payne and I am a certified dietetic nutritionist and certified lactation counselor at the Hudson River Healthcare WIC program. Today you're at 29 North Hamilton Street, which is the Family Partnership Center within the WIC office. I'm going to discuss a little bit about breastfeeding today. Any women can breastfeed. It's a very small percentage of women that are unable to make breast milk. Breast milk is something that cannot be manufactured. It is constantly changing to meet the infant's needs and development. Breast milk is a complete nutritional food. There's nothing out there to ever make it better. When a woman decides to breastfeed, she is deciding to fulfill a part of her motherhood, and she will need support and motivation and a lot of passion throughout her breastfeeding journey. There is no specific diet that a woman has to follow when she decides to breastfeed. We encourage a healthy diet just for mom's needs and to ensure that all nutrients are in play for mom. Breast pumps are not necessary for a mom to breastfeed, but it can be helpful during that transition back to work if a mom does have to go back to work. Women need to have a healthy pregnancy in order to ensure that their babies grow properly and that they are able to come to full term, which is 40 weeks, and that we can breastfeed anytime after delivery. So with a healthy diet, the WIC program can actually help. So you will be meeting a qualified nutritionist and they will provide you with benefits that are all nutritionally adequate food. A woman has to eat a variety of food every day in order to ensure proper weight gain and development of their fetus. When it comes to getting off on the best foot for breastfeeding, the pregnant woman should talk with her OB, and she should also speak with anyone on staff at the hospital that she's choosing to deliver. Rooming in is another tip that a mom can do, and this is where the infant will stay with mom after delivery and rather than go to the nursery. It's encouraged that a woman tries to breastfeed within the first hour after delivery, and this is usually done right after a woman completes skin-to-skin contact, or it's also called heart-to-heart, or sometimes kangaroo, sometimes cuddling. There's many names for it. This is where a woman would place the baby directly after delivery on her bare chest, and the baby will be just in a diaper or completely nude with a blanket on top, and it allows the baby to hear mom's heartbeat and regulates their body temperature and blood sugar levels. Sometimes a newborn infant will crawl to the breast on their own because they're hungry and they're looking to latch and to nurse. During this time, there are usually lactation counselors on staff at the hospital that can help with this experience. Skin-to-skin contact is important for all infants, whether a mom decides to breastfeed or not. We know there are plenty of benefits to that. When a woman decides to breastfeed, if she's having difficulty, it is important for her to let her voice be heard and to ask for help. If a woman is unable to latch a baby after delivery due to any sort of medical situation, breast pumps can be an important role. If this is the case, sometimes the hospital will have a staff member help mom pump and provide milk to baby via the pump, or freeze until baby is ready to have that breast milk. The first couple weeks after delivery can be very challenging for a woman, especially if she decides to breastfeed. A breastfed baby will eat many times in a day, generally 8 to 12 times. That is not the recommended. It can always be based on your baby. We encourage moms to breastfeed that baby on demand. Something that can help with that is avoiding pacifiers or bottle supplementation within the hospital. This allows the mom to learn their baby's hunger cues. Some of the benefits of breastfeeding are that it allows the baby to feel safe and secure when with mom. Breastfeeding can help to fight illness for the infant. It provides a stronger immune system and allows a two-way communication between mom and baby while baby is latched on the breast, so that they're constantly sharing information with each other to allow the breast milk to change and adapt to baby's needs. This means that if a baby needs more protein will be pushed into the breast milk. just from mom latching that baby on. It'll change and meet their needs. Breast milk also prevents baby from having allergies. So breast milk is a protected cell, so it kind of masks anything into the breast milk and allows for that transfer into the baby and allows them for easy digestion. Breast milk also helps complete the intestinal tract. It seals off those tiny little holes that the baby has in their intestines at birth and allows for further GI development. So breast milk also has ingredients for proper brain and eye development. And we also know that our breastfed babies generally have a higher IQ and a healthier body weight as they grow into toddlers and adults. It can decrease their risk for having type 2 diabetes and certain cancers. One of these cancers is breast cancer. It also helps to burn extra calories after delivery, which can help a woman get back to pre-pregnancy weight. There's certain things that a woman can do to ensure a proper start to her breastfeeding journey. One, she needs to ensure that she has a support system. If a woman does not have a support system, I encourage her to look for support in her community. There's many breastfeeding groups, there's many lactation counselors, and there's also the WIC program that can help. If a woman is lucky enough to have family members who have breastfed or are supportive of breastfeeding, she should communicate with them early on in her pregnancy to let them know her wishes about breastfeeding. Partners can also be a great support system. Dads play a big role in the development of their baby. Dad cannot breastfeed, but dad can provide skin-to-skin contact if mom is unable to do so. Dad can also take part in diaper changing, playtime, story time, any sort of activity that he would like to do with the baby. Some tips for mom to ensure that her breastfeeding journey goes as she wishes is to seek that support. That outside support home is also very beneficial. It sounds silly, but to sleep when your baby sleeps. We know that breastfeeding can be very tedious, it can be challenging, but it can also be very beautiful. Keep baby close with you, that way you know when your baby is hungry and you'll always have the milk ready available. Create a nice situation where you can latch baby at home, so whether that be a nice comfy couch, a bed, a pillow, whatever you might need to make yourself comfortable during this time. All babies are different, so try not to compare your babies to others. It's important that you learn your own baby's hunger cues, as that they're going to be the one that guides you during this time. So as a staff member of the WIC program and a lactation counselor, WIC recommends that all breast milk be provided to every infant out there. With the WIC program, we have women that have experienced breastfeeding firsthand, and these are called breastfeeding peer counselors. They are there to support any mom on the WIC program who needs that support during this journey. The WIC can also provide breast pumps if the insurance is unable to do so. Ultimately, breastfeeding is mom's decision. It's important for the community to support mom. It is a law that mom can breastfeed anywhere in public. She does not have to use a bathroom stall. She can breastfeed anywhere she chooses.